My name is John Phillips. I live in Tameside, Greater Manchester. I'm 77 years of age, and 21 years ago, I had open heart surgery at Wythenshawe Hospital. I became involved with a patient support group called the Ticker Club soon after I retired. We're a patient support group who see a vast amount of people from the Greater Manchester area who've had heart attacks. What's been developed at the moment is an advancement on the type of testing that they can do to make sure they get us to the right place for treatment. And now there's a finger prick test available for people who have or suspected having a heart attack, which can give an indication as to a bit more whether it is or whether it isn't. This has never been available before in the ambulance, but it is. They are looking at piloting and running that out, which is of great benefit. It'll have good impact for the patient because it will importantly get to the point of care quicker rather than maybe having to go through some preliminary tests at an intermediate hospital. It will also cut down tremendously, I feel, on the stress levels that a patient goes through, because whilst the quicker you can get somebody to the care point, the better it is for them from a psychological point of view to reduce their stress levels, because it's a difficult time. This would be a win-win all round, as I've said before there, for the patients, but also for the NHS, because there's quite a number of people who are admitted to hospital and brought to hospitals with chest pains, chest discomforts, and it's found when they get them here that it's not a heart-related condition. So having these tests at the initial point of care can only be a win for that. And for that reason, of course, it releases room, something that's always looked for in hospital situations. There's never quite enough room to get people in. So anything that can cut back on that, and doing it this way, of course, it's done safely in the respect that, yeah, you'll only be brought to hospital if they think there's something that they needed to get to hospital for.